Okay, now that we laid the foundation for our squat progression, we've talked a little bit about getting in the stance, the cues that we want to use to get into a proper squat and squat depth and how to activate that, going all the way from an air squat to a goblet squat to a back squat to a front squat to an overhead squat. We may not use the end of that progression super often because the more complicated you make the lift, the more challenging it can be. If your goal is building stability, then you use later on in the progression. If your goal is really building strength, you really want to use earlier on in the progression, such as a back squat. If you really just want to build strength, don't worry about doing an overhead squat a lot because you just want that, don't want to have to think about that overhead position. You want to have the bar on your back and just squat a lot of weight to build a lot of core and lower body strength, okay? But I want to get into a little bit about, let's get a little deeper now into understanding your squat stance, into understanding why we would use different single leg exercises or different versions of a squat exercise, okay? So to know the squat stance, you kind of have to judge it person by person. Yeah, we talked about in our last video about getting about shoulder width apart, and that really depends on the person's anatomy. You see their shoulders, you go from about armpit down, and if that reaches about the inside of their foot, their arch, that's great. It's usually a pretty decent stance for everybody. But depending on how they look when they squat, you may need to change their stance because there may be mobility limitations, such as their ankle mobility is different, or possibly their hip mobility or their hip anatomy limits their ability to squat. But if people can get in a relatively narrow stance, if their feet are able to be relatively straight, only slightly pointed out, but able to squat narrower, they might find that they can have more power in that squat position. Or if people are really struggling with mobility, they might need a slightly wider stance, okay? And so you need to diagnose as you're seeing people squat. If there's a point that they are squatting that you notice that their lower back rounds, or you notice that their knee really can't travel any far forward, you might need to adjust their toes slightly out. Remember, we don't want to go fully out because then you lose all that torsion, all that torque that you can put into the system with external rotation because you've already done all the external rotation with your stance itself. So if you see that their feet are turning out as they go down, or if you see the back rounding, then you want to adjust their stance to something that works better for them. Typically, someone who is dealing with a rounded back is probably going to need to do one or both of widening their stance slightly or slightly pointing their toes out. Okay? This is totally fine if it allows them to get deep into that squat position without a rounded back and they're able to really forcefully externally rotate their legs with their toe gripping the floor. It might be helpful to take the shoes off so you can find a better stance. Okay? So, again, if I can get into a decent stance and I can keep my feet straight without things getting rotated out, without crashing down, then I'm in a good squat stance for me. Okay? If you notice that, see my feet, if you notice that as I'm squatting down, my feet start turning out because I'm searching for mobility, I'm having ankle mobility issues that you're going to have to limit the range of motion. Maybe you have a correct stance, they're able to get their femurs out of the way, they're able to externally rotate, but because of their ankle mobility, you won't have them do a full depth squat because this specific player needs to have a shorter range of motion in order to be functional and safe. Okay? It's always safety first. You work within their functional range and you work on improving that over time. Okay? So let's say we have a player who's got the correct stance that gives them power, allows them to engage and initiate this movement properly, but there's a point that they lose it or they crash a little bit because their ankle mobility is limited. For that player, it may be better to just stop them at parallel or whatever the point is, they can keep really good control and position in their squat. Okay? So that's working with your functional depth and finding the correct stance that works for you, okay? So let's get into more of the different variations of the squat. Let's talk about, why would you use a single leg movement? Okay, the first reason is because this squat position, you're closing that hip joint, okay? And oftentimes we spend a lot of our day sitting whenever we're not doing any kind of physical exercise or walking. Especially for athletes, they want to try to conserve as much energy as they can in between their practice or in between their weight training sessions. And so they end up in this closed hip position all the time. And that creates a problem because whenever you're in this closed hip position a lot, that gets adaptively shortened. It means you get used to being short. And so whenever you extend, it doesn't want to extend. Whether you feel it or not, it kind of pulls your pelvis into this anteriorly rotated position or tilted position, and it creates pressure in this arch in the lower back. Okay, so we can intentionally train this because we want to enhance the mobility, the functional range of our hip. Okay, so you might choose to do a split squat sometimes with weights, and you can do different versions of weight on this. There's so many different ways you can do it. You might choose to do a barbell split squat. You might choose to do a dumbbell split squat, whether you're holding the dumbbells here or here. You might be holding it on a single side. You might be holding kettlebells in some way, okay? There's so many different ways to add weight to these squat motions or any exercise, okay? But whenever I'm doing a split squat, if my focus is on enhancing my hip mobility, then I want to keep this back leg in full extension the entire time. And so that means I want to keep my glutes squeezed the entire time. I don't want to see a straight line from the stomach all the way through to the knee as I come down, okay? I'm not so worried about this front leg because my focus is on getting really good hip extension, okay? I want to see that vertical line. If I'm working on I want hip extension, but I really want to focus on ankle mobility, then I'll change the way that I do the split squat so I can work on the functional range of my ankle, okay? So what I'll do here is rather than going just straight down where my shin is staying vertical, I'm not really working on my ankle mobility, I'll do a knee over toes split squat so I can work on getting that full range of motion in the ankle now. So yes, I am still getting a hip extension force, but I'm more focused on getting to the ankle in range of motion, enhancing that with weights in my hand or on my back, okay? The other benefit of doing a knee over toes is while the straight up and down works the quad and the glute pretty well, the knee over toe, you want to have that foot flat, that arch still active, big toe pressing down, but this really targets the quad quite a bit. So you're enhancing ankle mobility, but you're also getting that knee through a full closed down position. You're working on lengthening that knee, that patellar tendon, and working on getting that full range of motion in the knee as well, okay? So those are some benefits if you want to work on that full range of motion, that full hip extension, that full knee range of motion. That may be some reasons why you choose to do a split squat version. You may even want to increase the difficulty and you really want to target the glutes and the quads. And so you can even raise up that back foot. So you have now a Bulgarian split squat or a rear foot elevated split squat. Now when you do this, ideally you don't want your toes to be like this on the back, on the rear foot elevated position, because that's going to limit how far you go, just because you're kind of limited in how far you can extend that toe, okay? How far you can flex that toe up. So you want to put the top of your foot on top of whatever you're putting your foot on top of behind you. And this allows you to get much deeper in this squat, really getting that good hip extension and targeting that forward leg, okay? So another reason you might choose to use a single leg version is because you want to develop a single leg strength, okay? It's another way of developing strength with lower impact movements. You don't have to load your body as much for it to be super hard. And so if you have a player who's dealing with some back issues, or you're trying to deload them, or you're struggling to find enough weight around in the weight room, there's no gym access, then do single leg exercises to make it much more challenging to develop and maintain strength, okay? And this may also occur if you find that there's an asymmetry. So an asymmetry means that it's not the same on one side as compared to the other. Whether your mobility is different or your strength is different. Let's say I'm trying to develop mobility in one side more, so I'm going to do the single leg version so I can get through more full ranges of motion than I can with a squat. Or I want to develop the single leg strength better. Let's say if I see someone squatting and I notice they kind of shift to one side in order to stand up, that's because they're favoring or trying to use one side more than the other. So I may choose to use single leg exercises for a while or throughout the rest of the workout so that I can develop the weaker side much more. And so whenever you're doing your sets, you always want to start with the weaker side first so that you can use the best of your energy and effort on the weaker side and then do the more dominant, stronger side second. That allows you to develop that asymmetry. In sport, oftentimes, especially in racket sports, you end up kind of pivoting with your dominant side. So you're never going to completely fix the asymmetry completely so it's exactly balanced. That's difficult to do because they're automatically going to load that dominant leg much more than they are the pivot leg. But the more you can do in the weight room, you're going to decrease the amount of asymmetry that you see. And so there's less chance of injury and it's more acceptable movement and you're able to get better balance in your typical squat motion, okay? So you don't have any more shifting side to side. And the other reason that you might use a single leg squat motions or any single leg exercises is because you want to develop stability. You want to improve their ability to balance. And so doing these split stance movements, these unilateral movements, forces you to have to stabilize. It forces you to have to balance yourself and engage your core. And another exercise or another weight that you might use is, rather than holding two weights in any position, you might choose to hold one weight on one side, whether you're squatting or doing a single leg movement, because adding that counterbalance there or adding that weight on a single side forces you to have to stabilize and balance and activate all those small stabilizer muscles significantly more. You get better activation of the big movers as well. And so if it could be a proprioception or a motor control goal that you want to use there by adding a one-sided weight, or you're developing core strength and stability, resisting that rotation or that weight that wants to throw you off balance, okay? And so you also might use a single leg exercise because you're trying to rehab something. Let's say squat just doesn't feel good because you're trying to deload their spine. And so you want to do a single leg exercise so you can load that leg and develop strength and maintain strength without a significant load on the spine. Or let's say you're trying to come back from like a knee rehab, and so you want to do a knee over toes so you can get that knee moving through full range of motion. You'll do Bulgarian split squats in order to develop more quad strength. Or you might even do that low bar back squat like we discussed to keep the shin vertical, much more vertical, so that I'm not loading the knees too much. I'm developing the hamstring and posterior strength significantly more. And so you can use these different exercises in order to really load the body well and really get into a good rehabilitative state here. And these are much easier to add more tempo to focusing on single side strength and focusing on the stability of side to side, and they're really useful. And so as much as you want to do a bilateral stance that's nice and symmetrical and you want to develop huge strength through that, you also need to develop that single leg strength and stability, because in sport, more often than not, you're in some type of a split stance or some type of a counter or not a bilateral stance. It's not exactly lined up at all times. And so you need to develop the ability to stabilize yourself and have strength and ability through all types of different stances, okay? So that comes to a lateral squat. If we're gonna do a Cossack or Cossack squat, the reason that we would do a lateral squat, whether you're holding in a goblet or you're holding bar on the back or you're holding dumbbells in a front rack position, the benefit of this Cossack squat is just going to lengthen your adductors. It's like an eccentric lengthening of the adductor muscles while also developing the abductor muscles, the glutes, as you come back up. So as I come down, I want my knee to be aligned with the foot. I want to have a relatively upright posture. And this is lengthening these adductors as I come down. As I come up, I got to use my quads, my vastus lateralis, the outside muscles of the quads, and I got to use my glutes to come back, okay? This is really good for helping develop that lateral speed and change of direction ability. And also building stability, because this is a form of a single leg exercise. And the benefit of this is also, as you sit down, this is another way of really developing ankle mobility and control in that squat. I often use this in a warm-up because you want to open up the adductors to make sure your hips are open as you're doing just a normal squat in a normal stance, okay? So you do these lateral Cossack squats, you'll find that your squat can open up significantly more if hip mobility is an issue for you, because that eccentric lengthening really does help to strengthen the adductors. As much as we want to do contraction of the adductors, that eccentric lengthening is going to help lengthen those to have functional range and control, but it also opens up the hips because it's a nice feel-good kind of stretch, okay? So last thing we want to talk about as we get into more detail about the squats is, when do you use bands? When is it necessary to use bands? First one that you may want to use is a loop band. You put a loop band either around the knees if you're working on just a standing squat, or if you're doing moving motions, you'll get better activation in the hip by putting the loop band around the ankle, okay? So you'll want to use bands in order to build awareness, to build that activation of the muscles that you want to activate. Let's say you have a player who just has no awareness, they don't know what they're doing, and as they squat, they had this vagus error, but as you check their mobility, they don't have any issues with this internal rotation or this external rotation. There's no issues there. You don't see any sort of ankle stiffness, okay? If there's no mobility issues, then it's more of a motor control problem. And so for temporary time, you might put a loop band around their knees as they squat, and you want to squat nice and slow with tempo, because you want to see that they are engaging their glutes and pressing those knees out with the toes gripping the floor as they squat down fully into that squat position. And so it's not necessarily building any strength with that loop band. It's not heavy enough to build significant strength, but you are helping them learn how to use their body and keep a good position through the entire movement up and down, okay? So that's the first reason that you would use bands. The next reason is really building motor control. So you might use a longer band in order to put the band on the outside as you're doing a split squat motion, because you want to make sure that as they're doing this lunge, you don't want this knee vagus error. You want that knee to be pressing out, staying over the foot, and the toes gripping the floor as you're doing this motion. So this is a way of even doing a single leg squat that you can really build a lot of stability through the hip and gaining better activation of the glute, okay? You can even throw it on if you're wanting to develop strength in the adductors as you're going through a squat motion. Maybe you want to really build some stability in the hip. You might throw in an adduction bias where this is pulling you out on purpose, but it's forcing you to really grip the floor with your toes and really control that squat and force your adductors to be more active in that squat in order to keep better stability, okay? And you can even use it for offloading in your rehab process. Maybe you want to put it behind the knee. So this is a nice, look, it's pulling the knee forward, it's pulling this tibia forward as you're doing this. And so it can feel really good on a knee tendon as you're trying to rehab it back, because as you come up, you really have to use the quads to extend that knee to get to a full straight position, okay? And so these can be used in lots of different ways to build your strength, to build your stability. And this is how you can change and use these different versions of a squat, these different versions of these category 1 movements where there's a clear start and end motion. So you can develop strength in the bilateral stance or in the unilateral stance in order to develop mobility, strength, stability. And so hopefully this is helpful for you to understand how we choose and develop our players, our athletes, through right squat patterning and exercise selection in order to develop them. Think through this. Understand why you would choose these and why you might adjust on a given day. If a player just is beat up and they can't really handle a lot of load, their technique isn't good, their mobility isn't good, it's okay to switch to a unilateral stance and work with less load and still get a good muscular benefit from and a good stimulus from these single leg exercises that you're choosing. And sometimes it's better to, instead of using heavy weights in order to load the system a lot, sometimes it's better to develop more volume and get more hypertrophy or get more of an overall stimulus by doing a series of different single leg exercises, because you're able to do more repetitions at lower weight overall to build overall volume, okay? So this is our lesson on squat. This is our last lesson on our squats and squat variations. So enjoy.